Welcome back to Therapy Playground. I'm Megan Myrick. I'm a physical therapist.
And I'm Jenny Hall, and I'm an occupational therapist.
And this is Micah. Micah receives speech therapy, occupational therapy, and physical therapy at Therapy Playground. Like most kids, he spends a lot of time here, and we're working really hard to help Micah meet his potential. Our main goal as providers here is to ensure that children are maximizing their ability for independence and maximizing their participation in their function. We meet those goals in different ways. And a lot of times parents ask, what exactly is the difference in physical therapy and occupational therapy? We're here to discuss that today. So Jenny, why don't you start by talking about some of the things that you work with Micah, what your goals are, and how that might be different from what he and I do.
Okay. Well, usually when I'm asked this question, I start by telling people that occupational therapy is the ability, or we look at your ability to be independent and doing things for yourself. So for a child, that typically means playing or being able to function in a classroom, to be able to do your schoolwork, to be able to do your activities of daily living, which include bathing and dressing, toileting, self-hygiene, grooming. All of those things are included in all of our daily lives, but for a child in particular, a lot of their lives revolve around play and school. So for a child like Micah, he has difficulty using his left hand. So we're doing a lot of grasping and reaching with his left arm because we use our hands to be independent. And Micah wants to play, so we need that left hand to help us play. So we do a lot of sitting and reaching and grasping.
Very good. In physical therapy, my goals are a little bit different, although I want Micah to be able to do all those things. My role is to help him to be able to access those things. So for example, Micah's having difficulty assuming quadruped and crawling, getting on all fours. So we work on crawling, we work on his mobility skills. Eventually we will work on walking. We work on the overall strength in his trunk and his legs so that he can sit up and perform the skills that Jenny talked about. So in a nutshell, I would think that probably physical therapy is more focused on generalized strengthening and mobility skills, whereas occupational therapy is more focused on specific activities of daily living, like Jenny mentioned. But also, Jenny just finished a course on sensory integration, and so she's able to apply that to her therapy sessions with children. Do you want to explain that?
Sensory integration is our ability to receive information from all of our senses, which are our eyes, our ears, our nose, the sense of smell, the sense of movement, which is your vestibular system. All of these senses we take in every day. We take input from these senses, and we have to be able to integrate them in order to function. And if a child or a person's sensory systems are not processing these adequately, then it causes them to have difficulty tolerating things like textures. They may have difficulty eating or feeding. They may have difficulty exploring their environment because of these sensitivities. They may also be very hyper or sensory seeking. So that would be a child or person who was very active and was unable to attend to tasks because they were very, very busy trying to seek out the information that their body needs.
That's great. If you have any questions about what we have to offer at Therapy Playground for physical therapy or occupational therapy, please feel free to contact us or visit our website at www.therapyplayground.com.
Bye.